Extra-pulmonary tuberculosis in India. It is as common as pulmonary TB. It can involve cervical node, it can involve abdomen, it can involve pleura, it can involve pericardium, it can involve brain, it can involve spine, it can involve your joint. It is as common as your pulmonary TB. More often confused with many things. More often CBNAAT will be negative, MGIT will be negative. More often it is started based on clinical symptoms and signs. So what you need to do? How can I approach a case of extrapulmonary TB? Come on, let's see. TB can involve any organ, sparing your hair and nail. Remember, always try to confirm with histopathology by looking for caseating node. Always you need to look for, always any possible tissue sample should be sent for CBNAAT and MGIT. 2 samples should be sent. 1 sample, either saline or normal container, to NAT studies and culture, and another in formalin for HPE to look for caseation. The most common things that we often see is TB lymphadenopathy. Small nodes will be present in each and every child that visits your clinic. Almost all these children are getting evaluated for TB lymphadenopathy even when it is equal to the size of the egg of a mosquito. A highly mobile node is unlikely be due to TB. A highly mobile node is unlikely be due to TB. Point number 1. A small node is unlikely be due to TB. A node which involving the anterior triangle of neck is unlikely be due to TB. Highly acute in onset, extremely painful is unlikely be due to TB. The node persists for months together is unlikely be due to TB. The node that increases and decreases with acute viral coryza is unlikely be due to TB. But majority of these cases are getting investigated for tuberculous lymphadenopathy with Mantoux, FNA, CBNAAT, all stupid things. What you need to have only one important thing: counsel the mother, counsel the parents. You got worried, you just try to make the patients to get worried. Don't do that. Small, extremely small mobile node, anterior triangle of neck is unlikely be due to TB. Don't investigate. If you try to investigate a child with the Mantoux, majority of them will be positive. Why? Almost all children in India are infected. Why? You stand in a cinema theater, you get infected. You just get out of the house and travel in a bus or a train. Somehow or other you will have a TB patient nearby to it. That's India. So almost all of them are having Mantoux positivity, IGRA positivity, CTB positivity. You can't start ATT based on, oh, the nodes are not resolving. Mantoux is positive. Reactive node, granuloma is there. Granuloma is there in many non-TB cases also. A TB node. So look at this. There are nodes here, no nodes, but these patients are getting investigated again and again. Okay, then look at this node, a sizable node, 2 nodes, posterior triangle of neck. This child should be infected, my dear boys and girls. This child should be investigated. So what are all the features of TB? More than 2 centimeter, more than 2 weeks duration, skin not pinchable. It means there is an underlying inflammation.